The following interview contains commercial content. The products and services featured appear as paid advertising.
Today on Minnesota and Company, hands-free glasses that are helping people get their independence back. Low Vision Restoration has options for people with low vision so they can get back to doing their favorite hobbies or even their everyday activities like driving. Thank you for joining us today. I'm your host, Jessica Fix. Joining me now from Low Vision Restoration are Dr. Chris Palmer and patient Ann. And we should say too, Ann, you believe in this so much that you are not only a patient, but you also work for Dr. Palmer now too.
Yeah.
Which is incredible. We do want to remind you, there will be a QR code on the screen. So once you scan that, it'll take you right to a page where you can get a free consultation over the phone, which is great. Okay, so Dr. Palmer, tell us about Low Vision Restoration for people out there that haven't heard of you.
So I'm an optometrist that does what we call low vision care. I've been doing this since 2008, so 18 years now. And what I work with is not new. So I help people that have lost their vision or maybe were born with conditions that doesn't allow them to see well enough to do the things that they want to do in their everyday life.
Okay, so Dr. Palmer, what types of patients are you seeing? What are they dealing with when they come to you?
They're dealing with any number of conditions, including macular degeneration, Stargardt's disease, like my coordinator Ann has. Could be cataracts that can't be done with surgery, patients with albinism, retinitis pigmentosa, glaucoma, diabetic retinopathy, any number of things. It really doesn't necessarily matter. It's just they don't see well enough to do what they want to do in their everyday life.
Right. And Ann, what brought you to see Dr. Palmer in the first place? What were you kind of dealing with?
So I have Stargardt's, and that's kind of like people who have macular degeneration. I have central vision loss, but I have my peripheral vision. And I was watching TV, a commercial came on. It was Dr. Palmer advertising, and I had lived here for 20 years, and I was like, why don't I know about this doctor? And so anyway, I called him up, and we talked. And I had some devices already, but then, we just had a little bit more conversation about things, and turned out he was looking for someone to do phone consultations, which is now what I do for him, which is great because I relate to a lot of these people calling in. And but anyway, I also then, purchased a pair. I had the Bioptics, which are the ones for driving. From like 30 years ago, but then, upgraded with his, which were like night and day from what I was using. So
wow.
Believe in the product.
Yeah, and you're clearly an advocate. So if people do scan that QR code, they might end up talking to you.
They will. I'm the only one that does it.
That's amazing.
Yeah.
So everyone gets to know Ann, right?
Right.
Okay, so Dr. Palmer, tell me about these glasses that you've brought here.
So I brought two examples. One is for the distance. It's called a Bioptic telescope. And it's like a bifocal in that there's two parts, a top and a bottom. But they can be used for television, to recognize people, family and friends, sightseeing, go to a ball game or a play or the museum, to drive potentially, help co-pilot. The second one here is, we call it a reading telescope. It's in a position, it's positioned such that a person can see to read. We can have the telescopes put wherever we want to, depending on the type of activities that they're doing, and focused where they need to. Could be for sewing, could be for reading, handwriting, puzzles, putting model trains together.
Anything that's really intricate, because I don't have a vision problem right now, but even putting these on, you were saying a lot of surgeons use these types of glasses. I can still see everything, and if you are doing something that's really intricate and tiny, like knitting, that would be a game changer, because you can actually continue to do that, but you wouldn't be able to do that if you weren't wearing these.
Correct.
All right.
People stop living their life because of the problems they're having with their vision.
I want to thank both of you for being here today. Thank you so much for sharing your story. And as Dr. Palmer says, you have nothing to lose and everything to gain. For a free low vision consultation, scan the QR code on your screen right now or call 612-729-3030 or visit lowvisionofmn.com. We would like to thank Low Vision Restoration for sponsoring today's interview.